This is going to be the 12 lead placement video. So we're going to make sure that our patient is sitting in the correct position with his chest exposed. And we're going to begin placing our electrodes. So the first one we're going to do is, the way you're going to remember it is clouds over grass. And that being the white one going to the right arm or shoulder. And then the green one, labeled as RL, will be going to the right hip / leg. And the next one that we're going to apply is, we're going to remember it by smoke over fire. So we're going to take the black electrode, we're going to apply it to the the left arm. And then we're going to take the red one labeled LL, which is red. We're going to apply it to the left hip or left leg. And now we're going to move on to the precordial electrodes, which will be labeled V1, V2, V3, V4, V5, and V6. So we're going to start with V1, and we're going to find the fourth intercostal space. Now that we have the fourth precostal space, we're going to apply the electrode to the right side of the sternum. Then we're going to take the yellow one, which is marked as V2. And we're going to find the fourth precostal space again, and we're going to apply V2 to the left side of the sternum. Then we are going to skip V3 and we're going to go to V4, which is blue. And we are going to find the mid-clavicle line. And we're going to find the fifth intercostal space. So we're going to palpate until we find that. Once we find that, we're going to apply V4. Now we're going to come back to V3, and V3 will go midway between V2 and V4. Now we have two more electrodes. V5 is going to go into the fifth intercostal space, and it is going to be on the anterior auxiliary line. And all that we have now is V6, and it's going to go into the fifth intercostal space at the mid-auxiliary line. So once we have that one placed, all right, now that we have those done, that is the 12 lead